So hi everyone, I am Jessie Whittish with Kentucky Youth Advocates, and thank you all for joining this morning and spending the next hour with us as we all continue to try and figure out this new normal together. So today we're going to dive a little bit deeper into the federal support recently passed by Congress and how those are going to impact the lives of Kentucky businesses and Kentucky families and the businesses that serve them. And we'll hear from Deb Stein, who's a national partner. We also have some questions from Kentucky partners that we'll go over. And thank you to everyone who submitted questions via the RSVP form. We passed several of those along to Deb, who's incorporated those into her talking points. And then we'll try and address some others today. Just a reminder that the call is going to be recorded and your audio is muted. So we, like I mentioned, encourage you to use the chat feature to ask questions or add commentary. Deb said if there's some simple questions she can answer in the chat feature, she will. And even if we don't get those questions answered today, we also we'll download those afterwards and use them to inform the information we send out later, what we communicate with decision makers and stuff like that. So please, if you have questions, share that. And the chat is set so everyone can see it. So everybody can see your questions and then hopefully see answers to that. So with that, I am going to turn it over to Terry Brooks, who is going to introduce Deb and get us going today.
Great, thanks, Jessie. And thanks to all of you who are joining us today. I know that so many of you have such pressing issues in the midst of these times that just taking this period of time is such a compliment to your commitment. I hope that we at KYA regard our role as the independent voice for Kentucky's kids as even more critical during these unprecedented times. We are the first ones to acknowledge that we're not on the front lines like so many of you are. That frankly gives us both the margin, but also the challenge to make sure that we're trying to keep our eyes on policy and practices at both the state and the federal level. I feel like we have a pretty good sense of what's happening in Frankfurt. However, I will tell you that our featured star today has a much better sense of what's going on in DC than I think probably any of us do in Kentucky. And that's why she's here. Deb Stein has committed more than 30 years of her life. She began that when she was 8 years old, just so you know, around advocacy. Her early years were spent in legal services in a range of venues. She certainly brings academic cred, procuring a law degree from NYU and a grad degree from Princeton. She's worked with a number of advocacy organizations. She worked with the Hatcher Group, which was a really key partner in the early days of the blueprint as to how we did messaging. She is the founding executive director of the Partnership for America's Children. And that partnership really features multi-policy advocacy groups in each state. So KYA is the Kentucky rep for Deb. We find her absolutely invaluable in having that macro view of what's going on in Washington. Before the call started, and it's typical of Deb, she's like, I'm going to have to go off slides because there's developments happening as we speak that I want to bring your crew up to date on. So you are getting the latest, most relevant and pertinent intel from Washington. Deb brings a real kid's lens to us today. So Deb, thanks for joining us, and the floor is yours, or the camera is yours, I guess.
Thank you. So let me share my screen here. Let me share the correct screen. Okay. There we go. So as Terry mentioned, I lead the Partnership for America's Children. We have 52 members in 41 states, and KYA is our Kentucky member. I'm going to walk you through the federal legislative responses to the epidemic. And I'm going to point out right at the top that these happened in an extraordinarily quick amount of time. You probably heard an enormous amount about the conflicts and the confrontations between the Democrats and the Republicans, and those were very real. And at the same time, there was an enormous amount of very intense, very effective, very productive, collaborative negotiation. And that's the only way they could have produced these 3 bills in such a fast time. So the first bill, and I will add to that, you're going to hear about some problems with implementation. Keep in mind, this is all on an incredibly fast track, and that people are, as soon as problems arise, people are trying to resolve them. So the first bill was passed March 6th. The president asked Congress, I think it was February 25th, that might be a day off, to do additional appropriations in under $2 billion. Congress came back in 10 days or so with passing and getting into law a bill that covered $8.3 billion in emergency response. That first bill was primarily funds for federal agencies that needed to deal with it. So it went to the Health and Human Services, to the CDC, to the NIAID, which is the branch that Tony Fauci heads up. It was around development of vaccines, therapies, support of the state response, protecting the supply chain. It was all within federal agencies, and there was also some international funding. Then March 18th, which is only 12 days later, they produced the first big bill that provides supports to states and individuals. I cannot estimate the cost for you because that really depends on the length of the emergency. It included 5 really important things. The first one was free testing, because at the start, testing was costing people $2,000 or $3,000. Everybody can get free testing, and that includes undocumented immigrants. It included money to improve unemployment insurance administration and to make some changes in state unemployment. But I will talk about the big unemployment changes in the third bill later. This did not increase benefit levels or expand the eligible people particularly. The third piece is really important for 2 reasons. They increased the federal share of your state Medicaid costs by 6.2%. And in order to get that, the states cannot in any way reduce their Medicaid benefits, services, who's eligible. It does 2 very important things. One is it protects people's access to healthcare in an epidemic. It doesn't apply if you have a standalone CHIP program. And I don't remember if Kentucky has a Medicaid CHIP program or standalone, but I'm guessing you have a standalone. So CHIP theoretically could be cut back, but Medicaid cannot be. The second thing it does is it puts a lot of money into your state because you're going to have a state budget crisis. Every state in this country is going to have a state budget crisis. There are increased demands on the state services. People are going, ranging from, services for the unemployed to healthcare services. All kinds of things are going to climb dramatically that are demands on the state budget. At the same time, your state revenues are going to drop. You're going to have less sales tax revenue and less income tax revenue. So we know right off the bat that every state is going to face a major budget crunch, and every state but Vermont has to balance its budget. So that means that if we don't get more federal dollars into you, your state's going to have to cut back on lots of programs. This infusion of federal Medicaid money is a first step in reducing the size of your budget gap. So it's really important for that reason too. It also included some increases in WIC, in emergency food assistance for things like food banks. It had some tweaks to SNAP, but it didn't increase the SNAP benefit levels. And the fifth thing that was in that March 18th bill is that it made a new temporary paid leave program for paid sick leave or family leave where the costs are completely borne by the federal government. So it applies to organizations with less than 500 employees. That actually leaves out a lot of people that work at bigger organizations but don't have paid sick or family leave. It also allows organizations with fewer than 50 employees to seek a waiver if the paid sick or family leave would create a problem for them. So those are two really big gaps in it. The employer is fully reimbursed through a payroll tax credit. That means nonprofits can use it. The way it works is if you pay your employee, as required by law, sick leave or family leave, you then deduct the costs as a credit from your payroll tax. Now, for a lot of organizations, the paid sick or family leave cost may be bigger than your payroll tax. You'll get the difference refunded to you. So every penny is paid by the federal government, and I think they've even set up a process so that happens fast. There are two kinds of paid leave under this. One is 80-hour sick leave at full pay if the employee or someone the employee is caring for either is subject to a government quarantine order, has been advised by a healthcare provider to self-quarantine, is the employee themselves is seeking medical attention for COVID-19 symptoms, or the employee is caring for a child whose school or place of care is closed or whose child care provider is unavailable for reasons due to COVID-19. This only applies to illnesses related to COVID-19. It does not apply to unrelated sick leave or family leave issues. And then for 10 weeks at 2/3 of the pay, people can get emergency family and medical leave if they're caring for their child whose school or place of care is closed or whose child care provider is unavailable for reasons related to COVID-19. There are lots of gaps here. We know that people who are sick because of COVID-19, particularly the seriously ill ones, need more time for sick leave. It doesn't address people whose organizations had to close because of COVID-19, but it's their own organization can't pay them. A lot of gaps in this, and people want to go back and expand who's covered in it. But that was what was in the second bill. Then enacted on March 26th, a mere eight days later, is a bill that is being described as a $2.2 trillion bill. 2.2 trillion is 10% of GDP. It actually is even bigger than that. It is an enormous bill. And I'm going to tell you right now, I cannot tell you everything in this bill. I don't know everything in this bill. I've pulled out the key items for you. There's a lot of smaller items in there, but it is enormous. It is even bigger than it sounds because there's a piece of the bill which the Federal Reserve can leverage to do even more loans to big business, which I'll talk about in a moment. So it has 5 things I want to talk about. It has significant funds for state budgets, which will help them cover these costs and face less of a budget gap than they otherwise would. It has important supports for individuals. It has more than 1 trillion, and by some counts, it's sort of more like 4 trillion in business provisions, all of which can help nonprofits, which is important for you to know. It has some miscellaneous other that I'll just touch on to give you a sense of how wide-ranging the bill is. And then it has some gaps, and we'll talk about that in the context of what's coming next. So what's in there for your state budget, first of all? Federal money to states comes in 2 forms. It comes in grants to local and state governments, and then it also comes in picking up entitlement costs like for Medicaid. For the amount of money in this bill alone is more than this federal government spent last year on grants to states and local governments. I cannot emphasize enough how big the amount of money in this bill is. There's $150 billion specifically for states and local governments to meet virus-related costs, and Kentucky's share of that is $1.732 billion. There's $45 billion for the disaster relief fund. States have to apply for that, and I do not know I have not been able to find a state-by-state allocation. I think it probably depends on what your share of, what your particular costs are, but I do not know that for a fact. There's $30 billion for education, and that breaks out into 3 pots of money. There's a governor's emergency education relief fund that can be used for a pretty wide range of coronavirus-related educational expenses, cleaning supplies, all kinds of things. And Kentucky's share of that is almost $44 million. There's an elementary and secondary school emergency relief fund that is primarily allocated the same way that Title I funds are allocated, and that is almost $200 million for Kentucky, $193 million. And then there's a higher education emergency relief fund, which goes both to your public higher ed institutions and your private ones, and that is $153 million, almost 154. There's separately $8 billion for child nutrition funding when school's not in session. Now, it also has a waiver. Normally, you must feed kids school breakfast and school lunch on site, and they cannot take foods home. In this epidemic, there is a waiver that lets schools do grab-and-go feedings. Hopefully, all of your schools are doing that. There's also, this $8 billion is to help support you to do that. I could not find a state-by-state allocation on it. There's $25 billion for mass transit systems. There's $5 billion for community development block grants, 30% of which will go to state governments. There's $3.5 billion for childcare, and Kentucky gets $65 million of that. We do not think that is nearly enough. We're very concerned that we're going to see significant losses in the childcare community. That's going to make it impossible for parents to go back to work when the economy opens up again. And so that is one of the big asks that advocates have looking forward. And there's also $400 million to prepare for elections in the sense of making them safe during an epidemic, which could be, moving to all vote by mail. It could be electronically sending your ballots in. It could be more polling stations to preserve social distancing. The state has to put in a 20% match for that. And I think that is something that advocates want to think about raising, because it actually can make longer term improvements in your election system too. Individuals, there are 2 really big ways individuals are helped, and only the first one has really gotten the kind of attention it deserves. In fact, it's probably been confused in some ways with the second one, and that's not helpful. The first one is a one-time payment for anyone except for undocumented immigrants. It does not cover undocumented immigrants, but anyone who has what's known as a Social Security number that allows you to work. There are actually Social Security numbers that do not allow you to work. Who filed for income tax in 2019, or if they didn't in 2018, or Social Security beneficiaries, they will automatically get this money. If you filed with an ITINs, which is what undocumented workers file their taxes with, or if you are a citizen or legally authorized to work, but you filed jointly with someone who has an ITINs, you do not get these payments. And that is $1,200 per adult. There's also a $500 per child credit, which is only for kids with valid Social Security numbers. It starts to phase out at $75,000 for a single individual and $150,000 for a married couple. People who did not file their income taxes, and of course many people do not make enough money to be required to, they can go ahead and file now. And they are creating a simplified tax form for those people to do it. Advocates really may want to be reaching out to low-income families who have not historically applied to encourage them to apply to get this money. You also probably want to be keeping a sharp eye out for predatory tax preparer industry people who will be offering to file it for people and take a big chunk of that money. And that's potentially a big concern. But people who have not filed and haven't needed to really should be encouraged to file now and get that money. The other thing you should know about that money is it doesn't count against benefits as income. So people who are on welfare, who are on SNAP, can apply for that money by filing their tax return, and it won't damage their access to benefits. There are also, and this is actually the bigger money, it is available to fewer people, but it is much more money, and it's the people who really need it. So the one-time stimulus, probably 90% of the American population is eligible for. Oh, and there's no cap, financial cap on the child tax credit. Anybody with a child, regardless of income, gets the child credit. There are 3 new unemployment insurance programs, and the number of people who get it will depend on our unemployment rate, which could be, I've seen estimates ranging from 14% to 20% or higher. So it isn't going to as many people, but it's going to the people who are really hurting, who had jobs and lost them.
45. When the alarm's up to 140.
Okay, then there are 3 pieces, 3 different bills, and they have very similar names, so you got to be careful. The first one is Pandemic Emergency Unemployment Compensation, or PEUC. That's for people who already are eligible for unemployment under their state benefit plan, and it extends the length of time that they will be eligible. They can get an additional 13 weeks. That's true for people who already were on unemployment insurance, as well as people now, and that will go through the end of the year. The second one is Pandemic Unemployment Assistance, PUA, and it covers everyone not covered by traditional unemployment insurance. And I'm not sure it will actually cover everyone. They are still sending out the interpretations. I'm told the interpretations are narrower than we would like, but it does basically cover the self-employed, hourly workers, gig workers. I believe it should cover church employees or small nonprofit employees whose organizations were not required to pay into the unemployment insurance system. So it covers people who would not normally be able to get unemployment insurance at the same rate as your state plan pays for whoever is normally covered. It is retroactive to February or January, I can't remember when, and it goes through the end of 2020. And then there's a third plan, Pandemic Unemployment Compensation, PUC, which is an add-on for the people in both of the first 2 plans. So now through the end of July, anyone who collects unemployment insurance through either of those other 2 mechanisms will also get an additional $600 a week from the time the bill was signed, which was almost 2 weeks ago now, to the end of July, which means that someone who is unemployed will be bringing home $2,400 a month plus their traditional unemployment insurance. And that really is a giant, giant win for the uninsured. I mean, it's, you know, for a lot of people, it will be almost as much as they were making. There will be some people for whom it will be more than they were making, but remember, they still can't quit their job and get it. They have to have been laid off. And 2 other things you should know about all of these. One is the states are allowed to modify their job search requirements. Normally, to get unemployment insurance, you have to be ready, willing, and available to work, and you have to be actively searching. No one thinks in an environment where in the last 2 weeks, 10 million people applied for unemployment insurance, that job search is a sensible thing to be asking them to do. So those provisions can be waived. The second thing is the $600 a week bump does not count as income for Medicaid or CHIP and shouldn't disqualify you from getting Medicaid or CHIP. What's not in here, I will just flag right now, is access to health insurance for the unemployed. There's no improvement in that yet. Because you have to be able to work authorized, these 3 unemployment programs do not apply to the undocumented worker. There are some other relatively minor provisions. Student loan, federal student loan, not private bank student loans. Both the principal and interest payments have been deferred until the end of September, and I actually think the interest doesn't accrue during that time. But there's nothing that permanently takes the the loan payments away. There cannot be evictions from federally funded rental properties, and there cannot be foreclosures on federally backed mortgages now through September, but the rent and the mortgage payments continue to accrue, so then people will have lump sum payments due in October. So that is not a satisfactory solution. Something's going to have to be done so that people don't owe rent for that period, because they're not going to be able to pay the back rent. It included some additional WIC and food bank money, but it did not make an increase in SNAP. For retirees, they do not have to take their required minimum distributions from their 401ks. That protects the ones who can afford not to take their RMD from selling when the market's really small. It also helps stabilize the stock market so that stock values don't fall quite as much for those who have to sell to survive. So, business, huge amounts of money for business. There's a $150 billion Marshall Plan for the healthcare system. To everyone's surprise, Trump is planning to use some of that money to cover COVID-related treatment for the uninsured. Obviously, that makes and anybody who is treating the uninsured and takes that money cannot bill the uninsured. So that makes it much easier for people to seek and get treatment for COVID, and that is good. What's bad about it is two things. People had expected him to reopen the exchanges and let people get health insurance for all their needs, and to get subsidies for the people who are low income, and he has chosen not to do that. So people will be covered for COVID, but not for other health-related problems, and it depletes the money that was meant to be supporting other hospital-related costs. There is a $500 billion fund for big companies, including nonprofits. States and cities can also tap it, but it's only loans. So, of course, states that aren't allowed to take out loans and have to balance their budget. I mean, you could take out a loan for capital improvements, but not for your 1 year expenses. It's limited help to them. The amount of that can be greatly expanded because of the way the Federal Reserve is involved in making the loans. They can leverage it. I frankly do not understand the mechanism, and I've been told many of the people on Capitol Hill don't understand it. In fact, it's not clear to me anyone completely understands it except maybe the Federal Reserve. There's a lot of controversy over this fund because Congress put in what they called side rails to monitor who gets it and to make sure that the businesses that get these loans do not fire workers. The whole goal for the Democrats was to make sure that workers kept their jobs as a result. And the president has chosen not to implement the inspector general part of this. And there's a big fight over how this money is going to be used and who's going to get the funds. There's also small and medium business provisions, and those are really important for nonprofits because they all apply to nonprofits as well as to for-profits. There is a $350 billion small business paycheck protection program, which is described as a loan program, and it is a loan, but the important thing to know about it is that if you apply for it, the money you use for your first 8 weeks of payroll, utilities, and rent is forgiven. So it becomes a grant. So it may be a lifesaver for many nonprofits who will have their payroll, rent, and utilities, what they need to keep open, covered for 2 months during the epidemic. This fund is already, everybody knows it's running out. And when we talk about what the next bill will cover, it looks like there'll be an additional set of funds for that. It's administered by local banks, so people have to apply for it through their banks and not the SBA. There's also $500 billion for disaster loans, $10 billion in direct grants for businesses that don't qualify for the disaster loan program, $17 billion for the SBA to step in and make principal and interest payments for SBA business loans that groups are defaulting on, but the first one is the really important one for nonprofits. So I'm going to stop there. Actually, I'm going to go back. I'm going to stop sharing my screen, and we can talk about this before we talk about what comes next.
Great, thank you, Deb. That was.
Well, I'm going to try. There, now I have stopped
Okay.
sharing my screen.
Okay, fantastic. Thank you. Yeah, that was super in depth. Thank you very much for that. And I know folks on the call probably have a ton of questions. I've seen a few come through, one about sources, one about what college students are eligible for. I know there's still some questions about that that we don't have answers to. Perry had a question about the ask in the fourth stimulus, which we may get to. And then a question if there's anyone on this call who works with VITA sites, if there's any, if you have any insight as to what you are seeing. So we have a few partners that we wanted to take questions from, and we sort of selected them in advance. So the first one is going to be Gretchen from the Backside Learning Center. So Gretchen, if you want to introduce yourself and ask your question of Deb, and others, if you continue to think of questions and comments, please include those in the chat.
Thank you so much, and thank you to KYA, and Deb, thank you for all your great advocacy in DC on behalf of families. I work with the Backside Learning Center. We serve a population that is predominantly immigrants from Guatemala and Mexico who work in the equine industry at the track at Churchill Downs. And so we have a lot of mixed status folks. So just to clarify a couple points, and I appreciate you talking about undocumented folks at several points during your presentation. One is, so if my understanding is correct, the stimulus has to really be tied to that you have filed taxes. So those kids who are US citizens in mixed status families, there's no vehicle for them to access the $500 independent of parents. You have to have a parent. The parent is really the applicant. Hang
on one moment. I spilled my tea and a family member's bringing me towels. Hold on.
That's really something I expected, like Terry to say.
Amen. Amen.
I am not quite sure that's right.
Okay.
And I will look into it. Many undocumented immigrants have filed taxes with ITINs. And I thought, but I will check, that to get the child's credit, they just needed the child to have a social security number, even if the adults can't get the $1,200. But I am not certain of that, and I will check and get back to you.
Okay, that's great, because I think most folks are in that mixed status relationship. And the only other thing is, do you know if anybody has, I know there have been some assurances, but a lot of the fears out in the immigrant community are that it will be a public charge issue. So do you know if there's any good materials out there on, possible down the road negative consequences of taking this, especially since it's cash assistance, which generally is looked on poorly by immigration?
So I have looked at this from the context of emergency Medicaid. The COVID testing and the COVID treatment, well, the COVID testing is emergency Medicaid and does not count as public charge. Mm-hmm. Several states have produced policies that said COVID treatment would be counted as emergency Medicaid, and that would not be counted as public charge. I will look for, but I do not know offhand whether the stimulus would count as public charge. But of course, at the moment, they're not getting it. And any benefit a kid got isn't public charge for the parent anyway. So I don't think it's an issue, but I'll double check.
Okay, I appreciate it.
No problem. And could someone at KYA make a list of the things I'm promising to check?
Yes, if somebody else wouldn't mind grabbing that, and we'll also send you the questions that are coming through via chat.
That's great. I'm happy to get you answers for all of them.
Yeah.
But yeah, I don't actually think it's an issue. The part I'm less certain about is whether the kids still get the 500, but my impression is they do, but I'll check.
Okay. All right, thank you, Gretchen, and thank you, Deb, for your answers on those. I'm going to turn it over to Perry with the Pritchard Committee. Perry, I'm going to unmute you there, because I know you had a question about flexibility of some of the funding for the childcare sector, knowing that this is going to be pretty much a whole reboot potentially for that industry here and elsewhere. So I'll toss it to you.
Well, thank you, Jesse, and thank you to everybody at KYA for putting this on, and thank you, Deb, for providing us great information. I'm Perry Papka from the Pritchard Committee for Academic Excellence here in Kentucky, and we're a citizens-based advocacy group, early childhood through post-secondary. But Deb, you mentioned this already in your remarks, that childcare might be a disaster waiting to happen as we reboot the economy, and that's one of our big concerns. So I put a question in the chat, but also related to that is, one, how big, I've seen some national numbers, but how big of an ask should we be asking Congress for? And I think some national partners might have put a number on that. And regardless of what pathway it comes from, whether it's the Child Care Development Block Grant or another pathway, are people talking about the kind of flexibility states are going to need to provide providers to recapitalize, to provide working capital, to do rehiring of staff, to be able to sustain themselves as demand for childcare is going to take some time to recover. It's not going to be a light switch. Right. And so I'm slightly concerned. I'm starting to hear some of that, but I just wanted to get your perspective from a national level. Are people talking about that, and are we going to be flexible enough with enough money to do the things we need to do to reboot the system? And maybe what we could be asking specifically of Congress now related to that, to make sure that happens.
So I took this question and I went to some colleagues at the Center for Law and Social Policy and the National Women's Law Center. As the folks at KYA know, we work very closely with them on childcare issues, and they're more childcare experts than I am. And what they said to me is, I mean, this was kind of my take, but I got it verified by them. The problem, what you're allowed to use the CCDBG money for is very broad, and the agency plans to interpret it broadly, but the amount is so insufficient that by the time we get to recovery, there may not be enough money there. So first of all, the ask that the national community has come behind is $50 billion. We only got 3.5 of that so far. So states are probably going to want to use it on the most immediate and urgent expenses, and frankly, those immediate and urgent expenses are largely funding the emergency childcare centers for essential workers' kids, right? So there may not be money left unless we get more for the reopening, which is why it's so important to fight for that. There's a separate issue which I think is not, we can work out, but you know, it's still structured as part of CCDBG, and so it has to be organizations that can be connected to the CCDBG resources, but there's a lot of private pay childcare centers out there, and so I am not exactly sure where the technical policy fixes are on making sure that those childcare centers can tap into it as well. But the language itself in the statute is really broad, and they want to interpret it that way. The real problem is there going to be any money left by the time we get to recovery. But it is, just to be clear, it is CCDBG eligible providers. They don't have to currently be receiving CCDBG so long as they're eligible. So that is better than just current providers, but it doesn't cover all the providers, and we need it to cover all. Yeah.
Thank you, Deb. And I think look for more to come when we start talking about that fourth stimulus, not only, you know, later in this presentation, but also in the coming weeks. So thank you for that question, Perry. And I think we're going to be continuing to talk even more. So we have one final question from Riker Wilson with Murray State. Let me unmute you here, Riker. And if you want to introduce yourself and ask your question related to foster youth and independent living and who are trying to also navigate college. I know you work with a lot of kids who are kind of at the convergence of a lot of different challenges that they're facing.
Sure, yeah, I appreciate it. Thank you for the work that everyone's doing on here. These forums have been great too the last few weeks to keep everyone in the loop in Kentucky and what we can do for our families. I work for Murray State University in the Training Resource Center. I'm the Independent Living Coordinator for Kentucky. I'm also the supervisor for the Voices of the Commonwealth, which is Kentucky's premier foster youth council. It's made up of current and former foster youth ages 16 to 23. And I have some of them on this forum too that have joined us. And so they are great advocates for foster youth here in Kentucky. I have a couple questions, really kind of a two-parter, I guess you would say. When thinking about this bill, what does it mean for a foster youth in care? For example, how will foster youth be counted in the families in order to receive supports? And then the other one is for more transition-aged foster youth. What other supports are going to be available to those young adults who have aged out of foster care, or maybe currently remain in the system? Maybe they're in an independent living program and are either working or in school. Will the bill be enough to help those foster youth?
So this is actually a really broad question.
Correct.
Let me say, first of all, that the CARES Act, which is the one that got passed less than 2 weeks ago, put in only $25 million with an M, not a B, for child welfare. That's grossly inadequate. There is a real problem nationwide in that we know kids are more at risk when they're at home full-time with their parents. There are no teachers or child care workers observing them to see if they're being maltreated. The parents aren't getting the kind of respite care that it provides when the kids are out of the home for a significant period of the day. The parents are enormously stressed, right? Most of them are either working, going out every day and terrified of getting sick, or they're staying home with no money and they're terrified of not being able to put food on the table. So kids almost certainly the increase of abuse and neglect has gone up, but the reports of abuse and neglect are down by something like 50%. So we know that the child welfare agencies need to be trying to figure out how to monitor child well-being remotely, doing things like giving families technology so they can communicate with them remotely. They need protective gear so that if they have to go in and check out a family, they can do so safely. They probably need incentive payments, because if you have to remove a child from a home, how do you get a foster family to take them in when they might be bringing COVID-19 into the family? You need protective gear and the capacity for those families to isolate the kids until it's clear they're healthy. All kinds of grown expenses, and the federal bill does not cover that. What does it cover? The stimulus payment, which is not much, right? It's $500 one time per kid, will cover any foster child that has been formally placed. So any formal foster care arrangement, that child will get it. Foster kids will be covered by Medicaid, so they'll get, health coverage there. I do not know what your state has done for kids between the ages of 18 and 21. But, if you're one of the states that did expand foster care through 21, I'm seeing heads nod, then those kids will still get Medicaid. A lot of them are required to be in school or working to get those services. And right now, they may have been sent home. Their schools may or may not be doing distant learning. They may have lost their jobs. I am not sure what is feasible with waivers, but your state should be looking at that and trying to get waivers to keep kids in the program and funded. And at least one state that I know of is trying to extend all of those benefits past the age of 21 for kids who would age out during the epidemic. That is another thing that you might want to be thinking about at the state level. For kids in college, I think we are still waiting for a decision on whether kids who were in work study will be eligible for unemployment. I don't think we know yet. But kids who were working their way through college in other ways should certainly be eligible. You know, if they had unemployment that was not tied to work study, they should be able to get unemployment there. The kids who are living on campus may not have had a home to go to. That's a really big crisis that your state agency needs to be figuring out its way around. There are a lot of problems and concerns around kids in foster care. Some of them may need federal action. All of them need federal dollars. And so there is going to be a big ask for more money for the child welfare system in the fourth bill.
Thank you.
All right, thank you, Riker, and thank you to all of the members of Voices of the Commonwealth who are on this call. We're so excited that you all can join us and hope that you continue to do so. And thank you, Deb, for addressing that and for giving us a great segue to the fourth stimulus. Terry, I don't know if you want to add in any comments here to segue to the fourth stimulus and what might be coming, or we can just kick it right over to Deb.
Yeah, I just would affirm what you all, I'm sure, already know. We're convinced that all of you on this call, as well as other partners, have very vital, very authentic voices that need to be heard in Washington. We've been very encouraged that Leader McConnell has been very open. We actually are beginning a series of calls with his staff tomorrow on a sector-by-sector basis. Additionally, we are giving that input to Representatives Yarmouth, Comer, and Guthrie. So you know our attitude, which is that if folks like y'all don't give Mitch McConnell input, then it's on us. I mean, you know, we have to shape where 4.0 and beyond goes. We intend to continue that communication, especially with the leader's office. We're relying on folks like Deb to, frankly, coach us up. But I would invite you to listen to her, give you the macro. And then again, we are going to be launching a series of opportunities to give very specific input tomorrow. As an example, we have Leader McConnell's point people on childcare on a call, and we're going to have a very focused conversation on that. We would anticipate doing that same process in other sectors. So, you know, while this morning's call is really us learning from Deb, so we're a little bit passive, what I would tell you is we think the next chapter is going to be all of us being active advocacy voices to give them input. So I just want to make sure you know it's more than today's a predicate, listening to Deb's insight. Then the real work begins trying to Kentuckyize what that 4.0 means. So Deb, take it away. I know you've got late breaking developments even to share, so go ahead.
Okay, so I'm going to share my screen. Why did we go back to the start on that? Hold on. But we're not going to start by talking about what's on my screen because I really do have late breaking developments. Let's see where this puts us. Yes, okay. This slide is wrong. What it said was, and what we all thought through Sunday was that Congress was going to be working on a big fourth bill. The part that is right about it is that Congress is at home, they're on recess, and they are working a lot remotely. So this is, the fact that everybody is at home trying to be safe does not mean that nothing's happening. It's the reverse. Everybody is really engaged, the staff, the members of Congress themselves. As you work with them, one thing that you really probably should keep in mind is that a significant percentage of the senators and a fairly decent sized number of the House members are old enough to be at pretty serious risk for coronavirus. They really don't want to be there more than they absolutely have to be. I'm sorry to tell you that your Representative Massey probably is the most hated man in Congress because he forced all the representatives to come back and fly back and expose themselves because he was threatening to insist on a roll call vote, and he tried to but couldn't make that happen. when there was a process for passing the bill without that. And he had every opportunity to make statements. Anybody who wanted to could make statements. So it wasn't a matter of getting people on record. Everybody was already on record. And when I say he's the most hated man in Congress, that is a bipartisan hatred. I just need to let you know that because he's your guy. And you should be aware that his ability to be effective in Congress is probably zero right now. I would not spend a lot of time working with him because I don't think he'll get listened to if he tries to do anything. Lots of other people in your delegation, however, are very important and very effective. So, but I want you to understand that they're not going to want to come back until they actually have a bill to vote on, because they don't want to be there more than they have to, and they want it to be a bill that will pass without problems, without amendments, so they can be there as little time as possible. That doesn't mean that only a few leaders are developing it, though, right? There's all kinds of conversations and remote work, just like we're all doing remote work. And so it's important to work with all the members of your delegation, but you're not gonna, I don't really think you will see them come back until there is a bill they're gonna vote on, and they will be there as little time as they can. So that part is accurate. And I would have said 2 days ago, they won't be back till May. But what has happened in the last few days is that small businesses started to apply for the small business loan on Friday, which was the first day it was available. The Small Business Administration put its guidance out Thursday night. A lot of the banks are not sure how to interpret it. And it turns out that there is the overall cap on the amount of loans, but also individual banks are hitting their own individual lending. Because the banks are not sure how responsible they are for vetting the loan applicants, a lot of banks are only taking applications from people who currently bank with them, who they know, so that less vetting is involved. And so a lot of small businesses are finding, and nonprofits are finding, that their own bank isn't doing it or isn't doing it well, and no other bank will take them, and maybe their bank hit the cap for loans. And it's clear that the overall fund is going to be depleted, and there's a huge need beyond that. So what happened yesterday, I think, was that a Republican consensus started to develop that they needed a quick fix, just increasing the amount of money for the small business loan. And I'm not sure if they wanted 200 billion or 250 billion. The Democrats today, or maybe it was late yesterday, came out with a response saying that they absolutely were in support of an interim bill before we go back and do the big one. So this is not being called the C4 or the fourth round, it's being called interim. And the things that the Democrats want in it are 250 billion in assistance to small business, but they want half of that to be channeled through community-based financial institutions that serve farmers, families, women, minority and veteran-owned small businesses and nonprofits. And they want improvements to make sure that all eligible small businesses can access this critical funding and are not turned away by banks. They want 3 other things in there as well. They want 100 billion for hospitals. Some of that, I think, is in response to Trump using some of the original hospital money to pay for the uninsured. Some of it is because it is increasingly clear that hospitals are, losing millions and millions of dollars. They have an emphasis in there on the production and distribution of testing and personal protective equipment. They also want $150 billion for state and local governments to manage this crisis and to address lost revenue, which would be more than was in the CARES Act. Remember, I talked about how every state in the country is going to have a budget deficit. They're looking for more money to address that. And they want to increase the value of SNAP benefits by 15%, so that families that are already getting SNAP will get more, and families that are just above the SNAP eligibility line would get a little bit. So there's this interim bill that is what they're talking about doing really fast. Like, I could not find it, but I think they might be trying to do something this week. I mean, I don't think that would happen because it's already Wednesday, but I think it could easily be next week. So if you want to weigh in on the items I just mentioned, the small business money, the money for hospitals, money for state and local governments, and an increase in SNAP, you need to do that right now. And then the Democrats still want to do a big fourth bill. I have not seen anything from the Republicans suggesting they are not interested in it, but I also haven't seen their response to the four things that Pelosi wants to add, three things Pelosi wants to add. So they might say, well, if we do that, that's all we do, or they might be open to more. We'll just have to see. But I wanted to give you a flavor of what people are looking at for that bill. And the advocates are talking about the SNAP increase, healthcare for the unemployed, as I mentioned before, a very big child care increase, child welfare system improvements in money, something about nonprofit grants maybe, although the small business improvement might address a lot of that. I also think at some point they may need to extend the period that the grant is available for past June. Some advocates are looking for supports for the disabled, the homeless, or for expansions of the the federal EITC and child tax credit, so the most poor among us can get support. I gave you a list of things that the child care money might be used for to explain why we need $50 billion. I'm not going to walk you through that. And Pelosi had originally set out her priorities for the fourth bill, and some of that is what she's asking for in the interim bill, but she also wants transportation, free treatment for coronavirus, bigger stimulus payments, expanded leave provisions, healthcare protections for healthcare workers. The hospitals had gotten those removed from the Child Cares Act for the very practical reason that they knew they couldn't meet the standards. They didn't have the protective gear. That's obviously a huge problem. DC got treated as a territory and not a state, whereas normally in this kind of relief bill, it gets treated as a state. The financial difference is significant. She wants them treated as a state. And then there's some conversation about how to do oversight over that $500 billion loan fund for big business. That apparently the conversations with McConnell are going well, but I know no more than that. Sorry. And I did just want to say that there are issues around state implementation. I have touched on some of them, but your state legislature may need to allocate all those new state dollars. That's a state-by-state issue. I don't know if they do, but you should figure that out. Your unemployment insurance program, your governor needs to get all of those changes approved if he hasn't already, but the legislature doesn't need to act. And if you're going to make election changes, the legislature is going to need to approve that match. So a lot to work on both the interim bill and the next big bill, and also stuff at your state, including, as I mentioned before, the child welfare issues. So I'm going to stop sharing my screen and we'll go back to you, Terry.
Yeah, thank you, Deb. That was indeed a whole lot, as if there wasn't enough already that had come down. Obviously, there's still so much more to come, and it sounds like some real opportunity for some of the big gaps that you were talking about earlier. Before we sign off, I know a lot of people are having to hop off now. As Terry alluded to, there are some kind of smaller work group calls around some federal upcoming work within these sectors. We are also going to have another call just like this, another virtual forum in a week. Starting, it'll be at 10 a.m. Eastern time next week. And as of now, we have a staffer from Senator McConnell's office who is scheduled to be on the call. So in the follow-up email to this, when you'll receive the recording and all that, you will get information about next week's forum as well. So you can go ahead and sign up for that, and things will have probably changed very dramatically in the week. And if in the interim we have some action that you can take, we'll be sure to send that information out as well. Terry, I don't know, or Deb, if you all want to provide any kind of closing remarks to this group, but I will turn it back over.
Yeah. Jesse, can you hear?
Yes. Yes.
Okay. Well, first of all, Deb, huge thanks, at least from me. I learned a lot I appreciated the terrific way you summarized, and we're counting on you to be our current event expert to let us know what changes. I just want to reiterate what we said. Jesse was more subtle than I'm going to be. The call next week is intended to influence Leader McConnell's priorities. So what we need from you in real time is what those priorities are, what issues you need us to dig into. The sooner you can get them to us, the better job we can do of reconnecting with you to make sure that we understand what we need to be able to put on the table next Wednesday. Again, I would reiterate that we have found the leader's office really open to trying to understand the Kentucky context. So next Wednesday, we're probably going to do more listening to the staffer. But the bottom line is we want to have a lot of interaction with them before Wednesday. So I see Dr. Moonahan, so he understands the concept of authentic homework. This is real homework. We want to hear from you as to what do you think the key issues are, what are the questions, what are the conundrums that you're facing, and how can we get Leader McConnell's office to embrace those? So we're counting on hearing from you in the immediate. Deb, as Jesse said, I was so happy it was you, not me, spilling my drink. But otherwise, we really appreciate you being here. Thanks for your expertise. Thanks for what all of you are doing every day. Kentucky's kids are lucky to have you. Thanks.
Thanks, everybody. Looking forward to seeing you in a week, if not before then. And yeah, thank you so much, Deb. We really appreciate it.
It's my pleasure, and feel free to send me questions to answer. I've answered some very specific ones in the chat. I am happy to have you share my slides. And for the person who asked where the state estimates come from, the Congressional Research Service did some of them, and CLASP did the childcare ones. There's an enormous amount in this bill, and if you guys need to know about things that aren't in there, please ask, because it's also helpful for me to know what I haven't told you that you need to know, that I need to make available not only to you, but to the child advocacy organizations in the other 40 states that I work with as well. I hope that you guys can use this to help fight not only for Kentucky's kids, but all our kids across the country. If I can make one pitch to support what Terry says, you have some very, very important elected representatives. They're in a position to make a huge difference, not only for your state, but for every child in the country. And right now, that puts an outsized burden on your shoulders. And I'm so grateful that KYA and all of you are working on it, because it will make a huge difference for kids. And the other thing I'm going to say is it's moving unbelievably fast. So this is not the kind of situation where you think, all right, I'll do that in 2 weeks. In 2 weeks, the bill may be done. So thank you all.
Yeah, thank you, Deb. Writing comments. All right, thank you, everyone. Really appreciate it, and look for more information soon.
Hi, everyone. Have a great day.